very good morning and welcome to this edition of Perspectives Argued Radio Current Affairs Discussion Program. Today being April 2, year 2025, and then we're looking at the word Autism Awareness Day. My name is Fanen Kwanum, and I've been joined on the program by Grace Mbecheta. She is a therapist and director, Gracious Heart Special Needs Care Home and Therapeutic Center, Makudi. Grace, good morning.
Good morning, Fanen. Nice to meet you.
All right, so remember, this is an audience participatory program. And so in due course, I will be turning on the phone lines for you to join the conversation. In the meantime, you could take the number down 0814-335-9292. That is 0814-335-9292 for calls only when I'll be activating them at 10 o'clock. The number at 10 o'clock. And then for SMS and WhatsApp, the number is already on 0912-699-9404. And then we're also expecting another guest. Aboje Ojebe is a clinical psychologist at the Department of Psychiatry, Benue State University Teaching Hospital, Makudi, and founder Sound Life Initiative on Mental Health and Human Development. He will be joining us soon on the program. World Autism Awareness Day, observed annually on April 2, was established by the United Nations in 2007 to raise awareness about autism and promote understanding and inclusion for individuals with autism spectrum disorder. And that is why we've taken it upon ourselves as a media organization, to herald awareness into this day so that people get to understand what autism is all about. All right, and we have sound minds, authorities in the field in the house today that are going to educate us. But we will start the conversation with the guest in the house, in the studio, talking about Grace Mbecheta, as we wait for Aboje Ojebe. All right, so Grace, I'm starting with you immediately. So, tell us, what is autism?
The word autism is a neurodevelopmental disorder. It's called Autism Spectrum Disorder. Why it is ASD, Autism Spectrum Disorder? Because it differs, like the symptoms differs on individuals. So autism spectrum disorder, it's not a disease. It's a neurodevelopmental disorder that affects human beings' communication, behavior, and social skills. So autism disorder has been in existence for a very long time, and the United Nations in 2007 deemed it fit to bring this to limelight because of the way these individuals were always treated. In 2007, during the developmental, neurodiversity development program, the United Nations created an act to bring to the limelight what autism means. And this movement has created a great impact in the life of individuals, whereby these individuals are no longer discriminated, they are being accepted in the society. Autism spectrum disorder is not a disease. It is not an infection. Neither is it a disease that needs to be cured. It's a lifestyle. It's a way of life. It's a way people see things. It's a way people behave. So autism spectrum disorder is the way an individual with autism behaves. It might vary because of its, speech impairment. Most of them are speech impaired. Do you understand? It might vary because its method of speech impairment, the way they communicate, the way they are unable to, interact with other people, like other children. So autism spectrum disorder is a developmental disorder that affects the brain, how the brain functions, how the brain works, how the brain assimilates information, how the brain communicates, how the brain acts. Thank you.
All right. So this year's theme, which is advancing neurodiversity and the UN Sustainable Development Goals, SDGs.
Yeah.
So you said a lot of things. That it's not a disease.
Yeah, it's not.
Or it's rather a lifestyle.
It's a lifestyle.
We're going to dig deeper into that, but then we want to look at the significance of the day and how can we promote autism awareness in Nigeria as it stands right now.
Thank you for narrowing this down to Nigeria, because we actually need to
and we may even narrow it down to
into acceptance. They're being segregated. They were not being included in the society. They were not even regarded as human beings. Most parents with autistic children tend to even shy away their children from their other normal kids. I won't use the word normal because them too, they are normal. Yeah, it's just a way of life, but they tend to hide these children away because of the way they behave, the way they are not able to communicate their needs. Most times they throw tantrums. Most of them also have ADHD. You understand?
What's that? I don't understand.
Attention deficit hyperactive disorder.
Okay.
Yes, that's ADHD. That's why it is a spectrum, like I said. It encompasses all. It's not just narrowed down to one thing. A child might be, a child's own might be mild, another child's own might be severe, a child might be speech impaired, while another child might be, emotionally impaired. Do you understand? So it's a way of life, it's a lifestyle. So whatever thing that comes to you, you have to accept it that way. So this awareness needs to actually be more pronounced in Benue State, so that individuals be able to know what autism is. It's a lifestyle, it's not a disease. So that parents with autistic children will be able to speak out. It's not easy to stay with them because you're not able to understand them. They are not able to communicate their needs. You understand? So this awareness needs to grow into acceptance here in Benue State, not just the world at large. In Benue State, it needs to also be, we need to create an environment where these children are being accepted. We need to create policies. We need to create, a conducive place where they can strive like every normal child, where they can also participate in political sector, where they can also participate in every social sector. These children are being segregated from schools. I'm a first-hand experienced instructor and a therapist in this field, where kids, other parents with non-autistic children wouldn't want to mingle with autistic children. Reasons being that they don't want their children to keep behaving the way they are behaving. It's not their fault. It's a lifestyle. It's a lifestyle they've come to live with. It's a lifestyle they've come to see, and we need to accept them that way and create an enabling environment for them to also strive, for them to also live, for them to also be, accepted. So this awareness needs to blow in Benue State. Thank you.
So I just feel we are leaving something very important here. So we have been saying autistic children.
Yeah.
So I need us to narrow it down in a way that a layman, every parent will understand that these are the category of children we're talking about, so that we not only be assuming things.
Okay.
So autistic children, you say it's a lifestyle. So how is the lifestyle? How is it different from the other children without the condition?
Okay, they are speech impaired.
Okay.
What I mean by speech impaired, they are unable to communicate their needs.
Mm-hmm.
You understand? They are unable to say the way they feel. They are unable to communicate their emotions. They are non-verbal. Most times also, they can't work on themselves, like the activities of daily living, ADL. They are unable to, use the restroom, eat by themselves, feed themselves. They require help in every ramification of their life. But that doesn't make them not to be human beings as such. Do you understand? So autistic children are kids. It varies though. They are speech impaired, they can't communicate their needs. Social skills, they can't, they tend to segregate themselves from other children. They tend to be withdrawn in gatherings. They don't want to they don't want to be seen in different gatherings. They don't want to be seen in a noisy environment. You tend to see them closing their ears when the area is noisy. When the place is crowded, they are screaming on top of their voice because it's affecting their brain. Do you understand? So these are the lifestyle they behave, and most times when you see this, most individuals, especially here in Benue State, I've seen a parents telling the child, this one is an Ogbanje child, take this child away from here, this child cannot strive it, take this child to the river. That's not right. These are human beings God created. So autistic individuals are human beings like us. We need to just create an enabling environment to accommodate them. We need to create a place, put up things. Okay, we have a place like a sensory room. If an autistic child comes into this studio, he will be amazed. He or she will be amazed because of the lightings and everything around here. These are the things that attract them. These are the things that calms their nerves. When they see a quiet place, they play with nature, they play with lights, they tend to strive. You will see the inner beauty in them. Most times we tend to judge them by their outlook, but there are so much inbuilt in them because I work hand in hand with them. I've seen them there. They solve normal mathematics like every normal human being. They solve, difficult questions like every normal human being does. They are not witches or wizards from the village like the way we target here in Nigeria. They are human beings like us. The only problem with them is that they are unable to communicate their needs. It's for you to understand a lifestyle. It's for you to create a routine for them whereby they can actually express themselves. They work better with where hands can reach, with things that they know they want to do. You keep them in order and you create a routine for them. Okay, now you're going to take water, now you're going to eat too. Thank you.
Okay, do you have an idea why they are in that state, in that condition, that special condition according?
We have not been able to ascertain that yet. Doctors have not told us anything contrary. Some school of thought said it's as a result of what the mother took when they were pregnant. It's not known yet. There's no known cause of autism. There's no known cause yet.
All right, so part of the awareness is to create a more inclusive and acceptable environment for individuals with autism.
Yeah.
So in what ways do you think this can be driven?
In Benue State or in the world at large?
In Benue State, yes, and Nigeria at large.
Firstly, we need to encourage inclusive education.
Okay.
What I mean by inclusive education, we need to, create a units in different schools where these children can strive. Also, most children can also strive in regular classrooms like mainstream schools where you create a shadow teacher for them. That's what we call shadow teacher. Yes.
What does that mean?
It's a teacher that will be basically in class with the autistic child in a regular class where other kids are, and he will be the one, or the teacher, he or she will be the one to interpret what the main teacher is saying, the way the autistic child will understand it, because the main teacher won't have the time to come personally to come and interpret or speak in a language what the autistic child will understand. Do you get me?
In other words,
yes,
they need attention.
A special attention, yes. A special attention, a special environment. Their mode of teaching is different. It's not regular pencil and pen, marker and whatever kind of teaching. They work more with gadgets. They work more with toys. We do attention activities, concentration activities, coordination activities, fine motor movement activities. So these are they need to create this enabling environment for them to actually learn with that too. You won't expect them to learn at the same pace with every other child. Okay. So they need serious attention. We need to build infrastructures to accommodate them, and we already have one, Gracious Heart Special Need Care and Therapeutic Center.
Yeah, you're advertising your center. I may ask you to pay money. All right, so apart from inclusive education, as you said, are there other things that maybe parents of these children or the society in general would take into cognizance in order to to promote inclusivity as regards them?
Yeah, the parents first of all need to accept the way the kids are. That's the first step, acceptance. When you accept the way a child is, you tend to like work more on helping the child. So the major point is for us to start from the home where the child came from. Acceptance from the home. Let the parents accept the child, accommodate the child. Act as if the child is yours. Don't segregate and discriminate the child from your other children. Accept, see things. Don't lock them up at home. A child. Secondly, is out. Let the child see nature. Let the child see things. Experience life. If you're going on a vacation, go with the child. I know it could be very overwhelming for them because of the nature of the child's behavior, but tend to factor in the child in your daily routine and your activity. It will help the child's development.
Okay, so you mentioned about parents, trying to shy away from having the children and all that. So that brings us into the issue of certain misconceptions around, such children or such individuals, general conceptions, and then in the world or Nigeria in general.
The misconception people have about autistic children, they tend to see these children as kids that are mad.
Okay.
That's what they. So most of the times they take them to prayer houses, take them to different places, traditional herbs and all that. That's the first misconception they have. They need to understand that autism is a lifestyle.
Listener that is coming from maybe the hinterlands, and I want them to be a part of the conversation we're having here.
Okay.
Because most times these things, that is where they happen. All right. So, for instance, where I come from, these kind of children are called Joff. All right. So, I would like you to, follow that path, so that let's use our local language, so that the people understand that these are the kind of people we're talking about.
Okay. They in the place I come from, they call them witches, kind of. They call them Ndara.
Okay.
Let me use that local language. They call them Ndara, like mad people. You understand? Like because of the way they behave, because of the way they act and all that. So when we see such people in our environments, please encourage their parents first to accept the way these kids are, and they should give them more attention than other of their children. They require more attention. They just deserve love. When you show them love, you see them strive. There is so much beauty in them. So they need serious attention and love for them to strive.
Okay, so talking about the misconceptions again, I witnessed a situation and somebody said that during the night hours, the child usually converts into a snake and causes a lot of disruptions. And then you see them splashing ashes to monitor the movement of the kid by night. And of course, the following day, something happens, you see maybe like lines as if a snake has gone through that. And then it's usually a confirmation for them. So I'd like you to speak to these misconceptions.
This misconception actually needs to change. They are human beings. They are not snakes. Accept the fact that they are human beings too. Please, the misconception actually needs to change. They need to change their way of thinking. They need to change their mentality. Good morning.
You're on air. You're on air. Go on with the misconceptions.
They need to change their They need to change their mentality. They need to change the way they see these individuals. They need to accept them. No.
All right. Thank you very much, Grace Mbecheta. You is a therapist and director, Gracious Heart Special Needs Care Home and Therapeutic Center in Makurdi. All right. So we're being joined by Aboje Ojebe. There is a clinical psychologist, Department of Psychiatry, Benue State University Teaching Hospital, Makurdi. He is also the founder of Sound Life Initiative for Mental Health and Human Development. Yeah. Good morning, Mr. Aboje, and welcome.
Yeah, good morning, Mr. Fanning. Good morning, listeners, and I apologize for coming in late. I was held by the rain. The rain we've all been praying for.
It's finally here.
And
Morning, sir.
Good morning. Thank
Yeah.
you. Good morning.
Yeah.
All right, so you meet yourselves after the program. All right, so now, by what we're discussing, we're looking at World Autism Day, as you know.
Okay.
All right, and we've said quite a number of things. She told us, about autism generally, but I'd like you to also respond. I want to ask you that question: what is autism? Maybe you have a clearer or a different way of saying it from her. So, what is autism? Or
Yeah. Thank you very much. Autism is classified as one of the numerous abnormal behavior of childhood. Yeah, and that's what it is basically, and it is characterized by attention deficit, and these deficiencies in social and emotional interaction in children, as well as a deficiency in communication. It stems from abnormal development when the brain is said to be developing and setting how do I put it now? When there is certain interruption in the way the brain is developing, especially these brain areas that's responsible for coordinating this aspect of human functioning becomes deficit. All right, because the brain controls every aspect of human life, every aspect of the functioning of the human body. So if there is a maldevelopment in the area of the brain that is responsible for coordinating certain behaviors and certain aspects of the human functioning, there will be a deficiency in that area. So autism is its clinical presentation is seen in emotional and social, disturbances. Children with autism, you find that they have this social malformation. They don't function, normally in social settings, like difficulties in initiating, let me say, social interactions with their peers. Is impaired, and there's this emotional withdrawal, difficulty, delay in language communication, and all of that. And there are other clinical presentations such as repetitive and ritualistic behavior, which is abnormal. All right. So those are just a few description and clinical presentations of autism. Spectrum disorder. It is known as autism spectrum disorder.
Okay.
Because the nomenclature has actually passed. It's in classification of mental disorders. When it was initially discovered in 1943 by a psychiatrist at the Johns Hopkins Hospital by name Leo Kanner, he started by calling it early infantile autism. All right. And other researchers went into to discover based on their own discovery and studies, and someone came up by name Hans Asperger. He did his own findings and then came up with a disease called his own, his classifications kept evolving. All the different variants of it were combined together to, for us to now have what we call autism spectrum disorder. So when a disorder is a spectrum, it actually means that it has, degrees of severity. All right. When something is a spectrum, it has degrees of severity and all of that.
Okay, that means you have corroborated your viewpoint. She specifically said for the clarity of the layman that it is not a disease. It is not to be treated.
It's not
a sickness. That's what she said. To be treated and cured or something like that. How do you see it?
You see, basically, the essence of this program to mark the World Autism Day, it's not to come and sit down and blow a lot of professional jargon.
Okay, true.
Yeah, that is not the essence. The United Nations have, taken out this day, 2nd day of April every year, to mark what is known as the World Autism Awareness Day. So what we are trying to create here now is awareness.
Yeah.
All right.
Yeah.
So what it means is providing knowledge to the public, providing information in a way that people, our listeners, will understand. Our listeners are not professionals; they are lay people. So we have to present this in a way that I will possibly understand and make sense of what we are talking about here today. All right. So basically, is like she said, it's a disorder. All right, it has diagnostic criteria. Like those of us in mental health, and there's a manual we call the Diagnostic and Statistical Manual of Mental Disorders. And it provides criteria, what you see. When the condition meets a particular criteria of diagnosis, you diagnose. All right. So autism is diagnosable. It has been accepted into the Diagnostic and Statistical Manual of Mental Disorder as classified as a classified psychopathology, as a psychological problem. It is a mental disorder as classified. So, but what she's trying to say, or what you have said, she said, it's not something that can be cured. All right, it's not. It can only be managed. All right, it can only be managed through specialized cares and other forms of intervention. But it's not something that you can say, okay, this is where autism is. Let's perform a surgery and then take it.
An understanding towards individuals with autism spectrum disorder.
Thank you. First of all, we need to, accept them, acceptance, and secondly, we need to encourage the public, educate the public of how this works and how they behave, and accept them the way they are. Thirdly, also normal, every other human being. So we need to create an enabling environment. That's just the important points we need to do.
Okay, so over to you, Mr. Aboje.
Yeah.
We want to look at intervention now, and caregivers identify them, because some people say, pardon me, Ms. Mbecheta, said he or she was normal, the child was normal until so years, then it started behaving like this or like that. So, Mr. Aboje, how can we identify it early, and how can caregivers, do that?
All right, thank you very much, and thank you so very much, Ms. Grace, for what you've said so far. And like I said, the clinical features in autism, what to look at is the social interactions. You look at, one of the pointers is how do these individuals, usually children, these are the 3 pointers. For example, before I talk about that, let's look at the prevalence of autism spectrum disorder. I would like to refer to it as ASD at this point. All right. So what's the prevalence? Studies shows that it begins in early childhood and can be evident in the first month of the child's life. Yeah. It has as early as that. Yeah. First month of the child's life, it can be detected. The symptoms can be seen, because if you look at human development, at every point of human development, from infancy to early childhood to mid-childhood to late childhood to adolescent, early adulthood, mid-adulthood, and late adulthood, when people begins to wind down and all of that. These are physical developmental stages. You understand? At every stage of this physical development, there are behaviors that are appropriate for every developmental stage. Do you understand? There are social interactions, affective behaviors. I was talking about emotional behavior that is appropriate for each of these developmental stage. All right. So when it is not happening at a particular stage, once it is absent or delayed, all right, like in all deficit, a child with signs of autism, cannot really, is incapable of appropriate social interaction for that developmental stage. For example, initiating, playing with his or her peers becomes a problem. You see that child just being alone. It's just a lone ranger. Cannot initiate, playing. He cannot initiate a play with his or her peers. And even when an adult comes around and tries to play with a child, there is this unwillingness to yield. Yeah. All right? It's very, very common with children with ASD. And one other very, very prominent, social deficit is inability to say welcome or even to say goodbye when they are either entering a place or leaving. Greeting is a problem for them. Those little social labels, all right, is a problem with in children with autism disorder. Head naturally, they cannot function, socially, in a way that is appropriate to the developmental stage, and also emotional, the emotional interaction is also in deficit. Language, all right, it's there is this tends to repeat what he or she hears an adult say.
Yeah.
For example, when you look at a child, you say, "Do you want a cookie? Do you want to have?" Let me bring it down to our client.
To our environment.
Do you want to eat biscuits? And the child responds by saying, "Do you want to eat biscuits?"
Yeah, exactly. Like he repeats what you say, but he still tends to understand you when you show him the action. So what you do is you pick up the biscuit and show him, "Do you want to eat biscuits?" As he's repeating, "Do you want to eat the biscuit?" he's also stretching out his hands to pick the biscuit from you. Do you understand? So when you want to communicate with such children, you also act in what you're saying, in line with what you're saying. They tend to pick it more.
All right, yes. I was even going to ask you to, you have been relating with them.
Yeah.
So you have that special, what people will call grace. So walk us through. How do you interact with them smoothly on a daily basis, so that probably parents with children with, with ADS will also understand. So walk us through.
Firstly, I create what we call IEP. It's called Individualized Education Plan.
Okay.
It's actually tailored to suit the individual's need.
Yeah. Like individual specific interventions.
Yeah. In that individualized education plan, the social skills is there, emotional skill is there,
okay,
fine motor is there, behavioral modification is there, speech and language impairment is there. Okay. So it's just like a very big booklet. I have a short-term plan and a long-term plan.
For every child?
So for every child.
Okay.
Yeah. I have a short-term plan and a long-term plan. The short-term plan, it's for 6 months, and the long-term plan is for 3 years. So I start with the child based on the short-term plan. Easy communication. I use one-step word. There's what we call one-step word. There's what we call one-step word. If I want to come an autistic child, and I want to tell you to please pick up this book for me.
Okay.
I can't say, "Michael, pick up this book for me." I'm already confusing the child's brain.
Okay, yeah.
I'm saying a whole lot, and the child will just be gazing at me because he doesn't even understand what I'm saying. I will either say, "Michael, pick." And as I'm saying pick is a one-step word, pick. I'm actually picking up the book, and he's seen me do it. Then he understands that, okay, it's actually the book they want me to pick up.
Yeah.
By the time you tend to say a whole lot, like you're talking to them and you're like making a whole lot of sentence, you're already confusing them. Their brains are already accumulated. They don't even understand you. Secondly, I work on them on ADL. Most of them, they are activities of daily living. They can't self-help themselves.
Yes.
You will see an autistic child of...
Grace, wait. ADL.
Yes.
What is that?
Activities of daily living.
Okay.
Yes, that's what it means.
Yeah.
Go on.
I work with them on the activities of daily living. Most of them, they can't self-help themselves. They can't feed themselves. They can't dress themselves up. They can't even tell you they want to use the restroom. They tend to pee, poo on themselves. They can't communicate their needs. That's the right word. So I work with them on that. I set a plan on it, and I work hand in hand with the parents, because I stay like 4, 5, 6 hours with them. The parent stays longer with them. So it's a collective task. For it to yield results, I work hand in hand with the parents. So I create an activities of daily living plan where each hour I send the child to the restroom. We get there, you try to teach them how step by step. It depends on the age of the child we are working with. There's a child I'm working with. The child is 16 years old. I started working with the child when the child was 13 years old, but right now I can testify the child can use the restroom on her own. So the parents have been using diaper all through the child's life. You can imagine how frustrating it is. You understand? So here we create a routine for them. Each hour they use the restroom, for the child, depends on the age. Okay, let's say I'm working with a 4-year-old child. It will be a 30 minutes time. Each 30 minutes, I send the child to the restroom. As I'm sending the child there, I'm going there with the child. Okay. I'm teaching the child how to use the restroom. At first, it will be very difficult for the child. He will be agitating, he will be screaming, shouting. That's the way they communicate. It's either they scream, they shout, or they yell at you. They are trying to say something,
yes,
that they're trying to say something they're unable to say.
Temper tantrums.
Yeah, to throw tantrums, a lot of tantrums. Yeah.
Because one of the things about children, one of the presentation about children with ASDs, they are very rigid when it comes to daily routine.
Yeah.
Very, very rigid and very resistant to change.
Yeah, exactly.
A little alteration on
their
the child's routine, like serving milk in a different cup.
You've messed the child up.
Yes. When you'll be using a particular cup to serve the child the drink, and then you use another cup, you just wake up one day and say, okay, today I'm going to use a different cup. Yeah. It's that difficult for the child to accept.
The child will not accept the cup.
Yes. So as you can see, someone with that interacts very, very often. Yeah. With that's her area. She can testify to this fact. They are very, 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 very resistant to change.
Yeah. And, but once they grab the change, they hold on to it so tight. Okay. Like they walk with the routine. You will enjoy them when they grab the change, when they grab the routine.
Yes, one more question before we move to Mr. Aboje.
Okay.
All right, so all of this knowledge you're talking about, so I'm just wondering, how would parents who have children with ADS, get to understand all of this yourself? Because it's a whole lot of work.
It is.
So how do we get the knowledge to them, and how do we ensure that they are even applying the knowledge?
Okay, what I do, I create I have a daily communication plan. I communicate with the parents on what and how they should work with their child at home, what and what to do. Another step I need to take is to maybe, educate them. Do you understand? Maybe once in a week we'll have a forum where we discuss, our progress, our difficulties, how to go about it, what you experience, because we are a whole lot. It's a big community here in Benue State. Okay. I can tell you that it's a very big community in Benue State. Ever since we started speaking up, people start coming up. Exactly, I have an autistic child. People want to now associate. People want to know, how do you do it? How I want to be involved. I want to get involved. Be like, some neighbors be like, so you've had this kind of child all these years, and you are shielding the child away from the society, because that's what they tend to do. There's this, discrimination. So what I tried, that's my next plan. Apart from the daily communication, I want to create a forum where, I will educate them and walk them through. It will be a weekly basis thing.
Exactly.
Okay.
Yeah.
Well, I'm just wondering the fate of those without access to you, but it's fine. It's all about awareness, more awareness.
Yeah. This is actually one of the objectives of this program. And this day too.
It's not just today too. It's like awareness. It runs all through the month. All through October. It's Autism Acceptance Day. Apart from the 2nd October, that is Awareness Day. All through October is all through April is Autism Acceptance Day.
Okay.
Yeah.
Okay, Mr. Aboje. So we were talking about intervention. This is part of the intervention. So now we want to look at the diagnostic tools which you started talking about earlier. So I'd like you to speak more on that, and then of course methods for autism, diagnosis in Nigeria. And then when we talk about Nigeria, Benue State is also part of it.
Yes, and I'm very, very happy that I have a cool guest in our midst today that is practicing in that area. She has practical experience, because it's one thing to have studied a whole lot in your training as a mental health professional, and you also find somebody that is practicing. All right.
Yeah.
And there's always a difference between one who is a professor, is a professional, who has professed, and one who is practicing. I think we have, of course, I have been opportune to provide interventions, but what we have before us.
Yeah.
And looking at the diagnosis of the presentation of a disorder, it could be somatic disorder, it could be psychological disorder, of course, what we call abnormal behavior, psychopathology in mental health. diagnosis is not just something you just sit down and speculate.
Yeah.
There must be in diagnosis is stating what is the problem, what you have identified. And you don't just get up and then say, okay, this is what this person is doing, or this is what this is the cause. All right, there are levels of assessment. Like the doctor will just look at you. There's a level of clinical, there is clinical interview where you interact, you observe, and then you run other forms of investigations, like laboratory investigations, radiological investigations, and all of that. And then when you gather information from all of these assessment tools, you are now able to say, this is the problem, based on what the manual is saying. For example, as a clinical psychologist, you find a child presenting with emotional, social, and language deficiencies. You can't just say, okay, that's just one aspect of assessment. It's pointing you to autism, all right? Yeah. But there are other, investigations you need to do, like even investigating, the neurobiology, carrying out neurobiological investigations. There are tests such as the MRI, what we call the magnetic resonance imaging, that shows you the structure of the brain. And all of that. When you're able to do that, you gather these informations together, you get to your DSM. In mental health, we use the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorder, 5th edition. All right, go to autism. You look at the various criteria, like deficit in social interaction, deficit in affect, which is emotions, deficit in language, repetitive behavior, repetitive and ritualistic behavior. Over a period of time, you look at the onset, how long has this been prevalent? Then you are not able, when it meets the diagnostic criteria, then you're not able to state that, okay, this child is being diagnosed of autism spectrum disorder. Because when you get the diagnosis right, you get your treatment right.
Right, exactly.
Once diagnosis is gotten right, the next thing is now, what is the prognosis? Be the outcome of what we have done. Malfunctioning. Is this person going to survive this condition? That's what they call prognosis. For some diagnosis, the prognosis is good. Yeah. For some, the prognosis isn't good. All right. Like for autism has a good outcome. Yeah. All right. With the appropriate therapeutic interventions, yeah, the child will be able to do well and go through life and achieving his or her potentials and becoming contributing member of the family and society at large.
Yeah.
Oh, Mr. Abuja, thank you very much. I was smiling because it just occurred to my mind that unfortunately there are some persons around us in our communities that they have specialty in throwing away, children with ASD.
Yeah.
ASDs and other developmental
disorders.
Yeah.
So that's their area of specialization. They are certified. I don't want to call them witch doctors, but they are certified in that area, so to say.
Yeah.
In throwing such children away, and this is completely wrong.
Yeah.
And it's abuse of human rights.
Exactly.
And I think it should also be punishable under our area. The role of therapy in managing, ASD. The listener, when we're talking about ASD now, you should be, conversant with these terms. I'm also a professional, so I'm borrowing from the ASD, autism spectrum disorder. So when we say ASD, do not be confused. All right, so we're looking at.
It's not just a single therapist that manage ASD. We have the speech therapist.
Mm-hmm. Yeah.
Okay.
We have the ABA therapist. ABA therapist is applied behavioral analysis. We have the occupational therapist, like myself. All these, they work hand in hand, to help the child.
Yeah. Right.
The speech therapist help the autistic child that's, hand in hand with the attention exercises, concentration exercise. They lack concentration a whole lot.
I'm going to disrupt you now. It's 10 o'clock, and I'd like you to hold on for now. We'll stop at
let's stop at ABA therapy.
ABA therapy. Yeah. So we're going to continue from there. So we need to give our listener the opportunity to also ask you questions so that the aim of our program will be fulfilled. So after this short break, we are opening the studio lines for you to call in. The program is the Perspectives on Agit Radio 95.5 Star FM Makudi, and our focus today is on the World Autism Awareness Day, and that's our focus. We're trying to, create awareness about, the condition in children, also known as ASD. Or to share experiences with us, ask the professionals in the house questions and more. All right, the number for you to call and be a part of the program is 0814 335 9292 0814 335 9292. You can also send us a text or WhatsApp message on 0912 699 9404. 0912 699 9404. Engineer Augustine AK.
Yes.
All right. All right.
Okay, thank you for the topic of today. Actually, this same topic, I don't know if it is the same topic, but last year at about this time, the 6th, that normal human being has 42, and those people have extra gene which made it 43. I don't really understand, and I can't really remember again. But from there, human beings have. But from the discussion so far, it is like it is not about the gene. It's just let me say psychological, or let me psycho whatever, and then behavioral thing. So I want the clarification. Is
get to listen to the response.
Okay.
Thank you. 0814 335 9292. Call us and ask your question.
Hello?
Yes, good morning. The first name.
I call patients.
Okay, I call patients. Okay. Go ahead.
Thank you very much for the topic. My question is in regards to if these children with an ASD are properly attended to as they grow up, do they still have these, with their improvement, they eventually begin to behave?
Yes.
I don't know if you understand this.
Yes, I understand
whether
your
they
question.
eventually become normal like every other person.
Okay.
Or are there still traces that makes one to understand? Even if
Thank you very much.
Okay.
Have a great day. All right, 0814 335 9292. Call in, ask your questions, share more light as you have understood. Hello? Hello? All right, this caller, you have to call us back. 0814 335 9292. Hello? Hello, good morning. All right, 0814 335 9292. Hello?
Hello, good morning.
Yes, good day from high level.
Yes, sir.
Go ahead.
All right, I want to comment your program. It's very nice.
Thank
and
you.
the topic, two students, which as your guests are talking, I'm just getting insight, which I wish they can also clarify me on this. Yeah, these are two children that have graduated from primary school and they cannot read or write. And as we're talking, it's a challenge for the parents. So trying to take them back to the primary aspect of the education, whereby they will learn how to, put words together, two letter words, is becoming a problem. So in this case, I don't know what it is called. And
tuned, he would be responded to.
All right.
0814 335 9292. Call us. Hello, 335 92. Yes.
It's still patience from the Zakumewi. Sorry, and that question
Okay,
for
patience.
because they were mentioning a lot of like three major specialists that help them in these different areas.
Mm.
What about parents that are not so financially buoyant? How can they manage it? Because from the way they were mentioning the name of specialists, it seems like it's be financially highly financially implicated. So I'd love to get clearance on that. For humble backgrounds like parents that are not that financially buoyant, how can
Mm.
they go about it?
All right, that's quite clear. Thank you very much, patience. Once again, 0814-335-9292. We have all the way from now until 10:30 to ask our questions. Good morning.
Hello. Good
Yes,
morning,
yes.
Mr.
Good
Fanny
morning.
Wano.
Yes, thank you.
Am I correct? One nothing. Only one question I want to ask,
Yes.
high level.
Okay, Kun.
Ask that there's what again that I want to say. Um, like the other guy said, certain time that this defense program was brought up, um, the discussant, one of them said something like that, that the cost of the has something so abnormal with. So I want the I want your discussant to throw more light on that. Did you see that when someone's brain is, or maybe when somebody has a swelling in his brain, that the person behaves in an abnormal way?
All right.
There are two something
Uh,
I want to
Thank you very much, Kunle, for your questions.
thank
They
you.
are duly noted, and we'll take care of them. All right, you too can be a part of the program if you dial 0814-335-9292, and then let us have, the discussion. Hello. Hello. Good morning. Okay, call us back 0814-335-9292. If you're having difficulties connecting to us, you could change your location and then try again. Hello. Hello, good morning. Could you please change your location? We can barely hear you. Sorry, you have to call us back at 0814-335-9292 so that you can ask your questions. Hello.
Hello?
Yes, good morning. Hello, good morning. Okay, 0814-335-9292, or you can reach us via SMS or WhatsApp 0912-699-9404. Hello.
Hello, good morning.
Yes, good morning. What's your name and location?
My name is Mike Oguche. I'm calling from Chusa area.
Mike Oguche.
Yes, please.
All right, sir. Go ahead and make your contribution.
Okay, I just have an observation, and it's about our education curriculum. I think the panelists and even anyone listening that can that's in government in formulation of our policies. It goes like this. I think there are gifted children and then there are challenged children. In terms of gifted children, my thinking is if you put all of them in the same class where you have gifted children in quote now, those are children whose assimilation rate is very, very high. And you also now have in the same class some whose assimilation rates are very, very low. Like the last caller talked about children that has have passed through primary school but can neither read nor write. Now, in those kind of situations, it's those that are gifted, they are a source of demotivation and intimidation to those that are not so gifted. I'm not talking about those that are probably mentally challenged, that might not be identified, that are also in the same modeled up in the same class. So I think a more deliberate effort should be done in that formatory stage. And like the experts say, the primary basic education is where you make or mar any child. So we need to be a bit more deliberate in that, in terms of
All right.
segregating them to get them and put the brighter ones together so they can compete and become better. And then the ones that are challenged, they are offering what you offer
Okay.
them in terms of
Thank
teaching
you
is
very
also
much.
different.
Thank you
Thank
very
you, sir.
much for adding your light. Thank you.
Thank you. Welcome.
0814-335-9292 and then alternatively 0912-699-9404. Hello? Okay, you call us 0814-335-9292. Hello?
Hello, good morning.
Yes, good morning. What's your name and location?
My name is Emmanuel Idoko. I'm calling from the modern market area.
Okay, Emmanuel, go ahead, please.
Okay, I listened attentively, but I want to I want to be a bit practical here. I live in the modern market area, and I know of two kids who would like to receive this specialized form of care because their parents send them to the normal schools, and just like a caller said, there is no visible improvement. So what is it? I would like Ms. Grace to shed light on what is going to take to get their individual plans and what it will cost, so that I can, maybe the parents are not listening, I can also approach the parents and get them informed so that we can, assess the center she is trying to advertise and see what can be done for these kids. Thank you.
All right, thank you very much. Though we are just creating an awareness, we are not advertising anything for now. All right, thank you very much. All the same. 0814-335-9292. Hello.
Hello, good morning.
Yes, good morning. What's your name and location?
My name is Dorcas.
Dorcas. Dorcas who?
Dorcas Circular. I'm location is Boko local government.
Okay, Dorcas from Boko.
Yes.
So you have a question or contribution? Go ahead with any please.
I'm get to come. Hello.
Yes, we are with you. Dorcas, call us back if you can. Hello.
Yeah. Hello, sir.
Yes,
good morning to all of you in the studio.
Yeah, good
morning.
My name is Dennis Alam, calling from Boko.
All right, Dennis Alan from Boko.
Yes. Would that affect anyone?
Thank you very much, Dennis,
That's
for
my
your
first
question. Okay.
My second question is, believe me or not, in Africa, people use charm to attack others. So I'd like to know, when one is attacked with a disease, with this thing you're talking about, autistic spectrum disorder, is that treatable also?
Okay.
When someone is attacked using a special charm.
I think the question should be, can someone be actually attacked with autism spiritually? But it is noted.
When someone is attacked spiritually with the autistic spectrum disorder, is that also treatable?
Your question is noted. Stay tuned. You would hear from us.
All right.
Stay tuned. You would hear from us. 0814-335-9292. Call us and also be a part of the conversation. Ask us any question at all. We are here to take your questions and provide answers to fulfill the Awareness Day. Hello.
Good morning.
Yes, good morning. What's your name and location?
Hello.
Yes, good morning.
Good morning.
Yes, what's your name and location, sir? Okay, you can call us back 081-4335-9292. Hello, good morning.
Hello, good morning.
Yes, good morning.
Yes, now can you hear me now?
Yeah, it's loud and clear. What's your name and location?
Yes, my name is Vincent Ako. I'm from Michelle Baku Road.
Okay, Vincent, go ahead with your question or contribution.
Yeah, my regard to your guest in the studio, most especially Aboje Oje, my primary schoolmate and my good friend, way back in CAC Primary School, Wadata.
Good morning, Vincent Ako. How are you doing?
Yeah. Okay, I want to ask, though somebody has asked that question, but I still want to ask. Can you hear me?
We are with you. We are with you.
Okay, what is the difference between an autistic child and an imbecile child? I just want to know. I know somebody asked it earlier. And secondly, is it true that autistic children are most found among the well-to-do people?
Okay, okay. Thank you very much for your question.
God bless you, my brother.
Thank you very much.
All right, thank you. Do have a great day.
Thank you very much for calling in, Vincent.
Make a contribution on the program. Hello, good morning. Good morning. Hello, good morning. Well, this caller seems to be silent. So call us back 0814-335-9292. Hello.
Uswa Isaac from Goma, Anchihasejime.
Sorry, your name again?
You speak with Uswa Isaac from Goma, Anchihasejime.
All right, Isaac, go ahead.
Concerning the emotion, I would say autism is an abnormal behavior by the children who are known with it. Although we ought to be humane for them to thrive.
Thank you very much, Isaac, for your contribution.
Thank you.
Is emphasizing an enabling environment, which is what we are clamoring for the children with a condition to thrive. Hello. Hello, good morning. Hello, good morning. Hello. Something seems not right with the network, but let's keep trying. 0814-335-9292. And if you aren't getting through, you can reach us via SMS or WhatsApp 0912-699-9404. Hello.
Hello. Morning.
Yes, good morning. What's your name and location?
I'm Jeffrey J. from Book Local Government.
Okay. Okay, Jeffrey J. Go ahead. 0814-335-9292. Call us. Hello. Yes, hello.
Hello.
Yes, good morning. What's your name and location?
My name is Andufa from Goma.
Andufa.
Yes.
Andufa, where are you calling us from?
Goma local government, Abete.
Okay. Go ahead, please. All right, 0814-335-9292. Call us and let's have a conversation. Hello.
Hello, good morning.
Yes, good morning.
Yeah, you're on to Mr. Kayode at the back of Modern Market. Bam, bam.
All right, Kayode, please, your second name?
Kayode Jimo.
Okay, Kayode Jimo. Go ahead.
If I have such a problem of the since it's because of me who are discussing this issue this morning. I've been trying to locate where I can take this child to. I have a child of 15 years old and she's not working. She's get there to her. There is no distance there, so I don't know where to take it.
For you after the program, very much. 92 is the number to call, and very much 92 is the number to call and ask your question. Hello.
Hello, good morning.
Yes, good morning. What's your name and location?
Yeah, my name is Kwangi Sesewas. I'm calling from Makodi.
All right, Kwangise Tewase, go ahead, please.
I really want to appreciate this program that they have just brought. I'm a team man by tribe,
Okay.
and it is believed that somebody that is an optist is by name called Joe in our language.
Yes.
Right. They will ask you to go and throw that person away. If not because of this program I'm hearing today,
Hmm.
I wouldn't have not because of this program I'm hearing today.
Hmm.
I wouldn't have known that it's a lecturer man that just came and joined her.
Hmm.
And they should give us their contact so that we're able to reach out to them when we run into a situation like that, and we should be able to assist or see if we can take the person to where they are and for counseling all that stuff.
Okay.
Thank you very much. I appreciate it.
Okay, thank you very much, Mr. Kwangise. 0814-335-9292. Call us. Hello.
Good morning, Mr. Kwano.
Yes, good morning.
We are speaking with Kwangwuta from Bajimba.
All right, Kwangu Tahab, go ahead and ask your question and make your contribution.
And I'll first of all ask a question, then I'll make my contribution. I want to ask, is this thing, can it be treated medically? That's my question.
Okay.
And then my contribution is, I suggest they should establish classes or section in schools to enable or throw more light about this thing, because like people are saying, especially we the teen, we believe that such people or such children that are not meant to be with humans, that are supposed to throw them away and are supposed to be far from human beings. So, but listening to this program now, I understand that these were still human, they're still valuable. So if they have sections that will throw more light, so some people it's just that they're ignorant of it. If they throw more light on it, I think people will understand it more better as I'm understanding it now.
All
So
right.
that's my contribution.
All right. Thank you very much, Kwangu Tahab. And
Thank
they
you,
have a
sir.
great day. 0814-335-9292. Few calls.
Hello, good morning,
Tony.
Mr. Tony Babu.
Okay, Tony Babu, go ahead, please.
Yes, good morning to the guests.
Yes.
Yes, I want to know what.
Yeah, yeah.
Yes, I say in the situation where the child is not talking,
Mhm.
what could be the solution?
Okay.
Yes,
Stay
that's
tuned.
just what
We'll answer you.
I want to hear about. Child is not talking, so I want to know whether this child can be also rehabilitated.
Okay, thank you very much, Mr. Babu. Please
Yes,
stay tuned. We'll respond
yes.
to you. 0814-335-9292. One or two calls, and then we're out of this segment. Hello.
Hello, good morning.
Yes, good morning. What's your name and location?
Agabu Thomas Tisu calling from Benekush and Makodi.
Okay, go ahead.
Yes. We are presently
Mm.
having such of how it can be avoided. That's the question.
All right, thank you very much, Mr. Gabo, for your question. 0814-335-9292. Okay, go ahead.
Yes, mine is that these children, will we say maybe through the birth, or is it such a child must have come because of what their grandfathers have done before? That is why such people have to be.
Oh, God.
Is there anywhere medically that we can understand whether those children, because sometimes you see them, they develop such things in their life. And some people will conclude maybe it is their forefathers what they committed those days that led to those children. And secondly, again, in the school, we feel that these children also can be something for the people. I think they can be put in the school, but they finally, if for treatment, like as the medical people have said, I think they should have a place that they will treat them, and they should treat them at a lesser cost. I have an example today that a lady developed such a thing, and the medical doctors told that person that they have to pay 2 point something million. But before you could know it, he said they are going to 20 something.
Very much, Emeka Ingogo, for your contribution and question. All right, so this is where we take a pause on the course for now to respond to the several questions that have been asked. Maybe after the responses, if there is still time, we will take more questions. We still have some in the text and WhatsApp message there. We're going to respond to as much as we can. So for now, we want to return to the questions. All right, we started with Engineer Augustine Eke from North Bank. He did talk about extra genes. So, Mr. Aboje, are there extra genes that cause this condition in children?
Thank you very much. I want to take this time to appreciate all of the callers that have called in to ask questions and make inputs and all of that. You see, he was referring to a program like this that was done, probably last year.
Yeah.
And somebody made mention of extra genes and resulting to abnormality and all of that. There are a lot of neuropsychological disorders, or we call them neuropathology, and they are otherwise classified. There are a lot of them. One of it is what we call the chromosomal disorders.
Yeah.
All right. Every normal human being has 23 pairs of chromosomes.
Yeah,
23 pairs. So that is 46 in all. And upon fertilization, all right, the sperm cell has a nuclei that contains 23 chromosomes. And the ovum or the egg, from the mother that is fertilized by the sperm has a nuclei with 23 chromosomes. So when fertilization happens, the chromosome from the sperm and the chromosome from the egg unites, all right, to give us 46 chromosomes in a human being. All right.
Yeah.
So for certain reasons, maybe as a result of, let's say, deterioration of these gametes, all right, maybe for some reasons, the chromosomes happens to be extra or even deficient. Of course, you can't have a normal child.
Yeah.
All right. That is the theory behind children with Down syndrome.
Down syndrome, yeah.
All right. It's quite different from autism disorders.
Yeah.
All right. Children from Down syndrome, children with Down syndrome. That's the theory behind it. It's a chromosomal disorders, and they fall under the same family of disorders called neuropathology, or they call them congenital malformation as a result of congenital malformation of the nervous system. Is a broad family for these disorders. That is abnormal malformation of the nervous system. The nervous system contains the brain, the spinal cord, and the brain cells called the neurons. All right, the autonomic nervous system and all of that. And the nervous system is responsible for how an individual is able to perceive, and the brain coordinates every part of the human body.
Yeah.
So if there is a malformation, if there is an abnormal formation of the brain during the development of the fetus, during pregnancy, during prenatal development, definitely certain disorders are going to ensue. All right, certain disorders are going to ensue. Just like in the case of ASD, the malformation affects the social interaction of this child, the emotional interaction, and the language development. All right, but there are other disorders that stems from this malformation of the nervous system. Congenital, in the sense that it is from birth. It is largely from birth. And that will take me to answering the first question from this caller, when he says, some are saying it is and all of that, extra genes and all. Autism spectrum disorders, there is a theory in explaining the cause, the why. That is hereditary. Of course, it's if an individual, a child with autism grows up into an adult, gets married, of course, that deficiency is encoded into the person's chromosomes and into the person's genetics. And when he or she gives birth to children, that child born is predisposed, inherits that gene. Do you understand? So genetics explains it too. All right. But largely, as captured by research, it is a neurobiological issue. That is to say, maldevelopment in the brain.
Yeah.
All right. And then the last scholar was talking about how to avoid these conditions. A lot happens during pregnancy. A lot happens during pregnancy. Like I'm privileged to be, serving currently in a mother and child hospital. All right. I am currently doing a work on teratology and how psychological distresses affect mothers in pregnancy and the unborn child. All right. There is a field called teratology, which is the study of agents that can affect children while they develop. All right. So certain teratogenic agents, like things that pregnant women take, like psychoactive substances. Let me take you back to drugs. Like psychoactive substances, alcohol, marijuana, and other psychoactive substances, when taken during pregnancy, exposes the child, to this kind of problems, such as also the health of the mother. That is why health care or attention, health care during pregnancy is very important. Very important. Like the disease, certain health conditions alter the development of the fetus, like what we call VZV, varicella zoster virus, or chickenpox. All right, it's very lethal. It's a very potent teratogen. Things like metals, like iron, lead, certain foods, even the weight of the mother, even the weight of the pregnant woman, certain psychological distresses in pregnancy, like stress, anxiety, depression. All of these, have tendency to affect the smooth development of the fetus. And a pregnant woman was asking me in our clinic one of these days, she said, what is the, because she said, but the first trimester, during the first trimester, which is the first 12 weeks of pregnancy, she said, the belly never come out now. Why are you telling me it's the most critical stage of pregnancy? I said, between the first 12 weeks of the pregnancy, upon fertilization, 3 stages happen. We have the germinal stage, the embryonic stage, and the foetal stage. All of these stages happen within the first 12 months. All right. What happens at the embryonic stage between 2 to 6 weeks of the pregnancy is that the different cells, because these embryos develop, all right, certain cells, the cells form certain layers. We have the outer layer called the endoderm. We have the middle called the mesoderm, and the ectoderm, the mesoderm, and the endoderm. These are the different cell layers during the embryonic stage of pregnancy between 2 to 6 weeks. These different layers of cell begins to form the different systems. Like the outermost layer of the cell called the ectoderm develops into the nervous system, where we have the brain and the spinal cord. They begin to develop. That's where the reproductive system forms, the digestive system, the endocrine system. All the systems begin to form within 2 to 6 weeks of pregnancy. So tell me, exposure to any of these teratogens during this period of development of organs and systems, what happens? A maldevelopment, something can interrupt the smooth development of this fetus, and that can result to this neurological maldevelopment and all of that. And any alteration, especially the formation of the nervous system, any alteration in the development of the brain affects cognition, affects learning, affects, depending on the area of the brain that did not develop properly. So this is possibly one of the the etiology why we have these congenital malformations. Is very important. So to avoid these conditions, we must take antenatal care very we must very seriously care to the pregnant woman very seriously. And that would
all right. So let's also look at the question by our patient. She talked about, is it completely healed after all this care and all that? So, Mr. Abuja, I'd like you to respond quickly, then I pass the baton to Grace.
Okay, talking about the complete healing of people with this condition, the deficiency is already there. Like I said, the brain controls every functioning of the body. So if there is a maldevelopment, a neurobiological deficit is already existing. All right, there are radiological findings. You do an MRI, it will show you. Okay, if you do it things like a PET or a CT scan, it will show you that certain part of the brain is deficit in both in structure and in functioning. So what do you do in this case? Like she said, is to manage it. Do you understand? You manage it through, there are different management. It can be managed through medications and also through psychological therapy. Are you with me?
Yeah.
Through psychological therapy. But it's been proven that psychological therapy is more promising.
Work better.
Yeah, it works better.
Yeah.
It comes with it. The results are more promising
Yeah.
because you are beginning to teach this child. Of course, let me be very specific. Behavioral therapy. What do you do in behavioral therapy? Is behavioral modification.
Yeah.
All right. The behavior that is deficient, you teach the child over
Yeah.
time.
Yeah.
The behavior
Okay.
that is deficient, you teach, and the behavior that is undesired,
Yeah.
you also help to modify.
Modify it,
You understand?
yeah.
So that those undesired behaviors, as a result of that developmental deficit, will go into
Go into
extinction.
extinction.
Yeah.
And then the one that is desired
Desired.
will keep getting practice and with reinforcement. Because you see, there is something about the brain of a child. The brain of a child is yet to specialize. It's just like the brain has not yet grasped what he or she wants to do
Yeah.
in the future. That is why neurosurgeons like Ben Carson, in order to help children with seizures and epileptic seizures and other neurological issues, he can afford to take an entire hemisphere of the brain, do a surgery, take an entire half of the brain out to solve the problem, and the child still grows normally because the remaining hemisphere of the brain can then grow up and take on the function of the diseased brain or the one that has been removed during surgery. So as the child is growing, that's why we emphasize early detection of this condition so that learning can begin to happen early enough. All right, instead of trying to correct an adult, you should train a child and put
from the onset.
through teaching and behavior modification, the
Great.
behavioral issues that are lacking can
I want to
be
add
learned.
to what he actually said.
Okay,
So,
go ahead.
Early intervention is the key, like we always say. But you actually channel the child, like when you're grooming the child, when you're teaching the child at that early stage, you get to pick out what the art works, that the child is able to live well in the future. You keep managing the child.
All right. So, Grace, those of you that are into therapy, how affordable is that?
It's very affordable, considering the society we are in. So we make it very affordable.
Okay.
Yeah. It's a monthly basis thing. If you can't keep up with this month, we prepare for the next month. It's so affordable.
So, like on
I should
average, how much does it cost to, maybe manage my own kid, for instance, for a month, on average?
On average, it's 40,000 naira.
Oh, wow.
We don't charge based on the services we render.
Mm-hmm.
We are just giving back to the society.
Okay.
Yeah. It's more like giving back. It's more like an NGO work and all that. We are giving back. We are creating an awareness.
Okay. Yes, I was thinking that non-governmental organizations would have to intervene, and maybe public-spirited individuals will have to intervene.
That's what we are actually working on.
Because 40,000 naira may seem affordable to us here in the studio, but then elsewhere it's a whole lot. There are people that earn less than that in a whole month.
Exactly. Anyway, it depends on the services you're coming for. If your child is speech impaired, you're just coming for speech therapy.
Yeah, speech therapy.
You understand? So this like average of everything you're going to pay. If your child is mobility impaired, you understand, for the cerebral palsy kids that their mobility,
So
they can
based on those levels.
Yeah, it's based on those levels.
It's
so,
all right, but until you draw closer, you cannot know.
Yeah, you will know.
So let's look at this one. Benjamin Guda of High Level Makudi was worried that he has 2 students that can't read at all. So what do you suggest?
I was actually discussing with him that, the child might have learning disability. A child that can't read, the child might have dyslexia or dyscalculia. This is a learning disability. You understand? Behaviorally, the child is okay. But when you bring paperwork or, letters and numbers, the child is totally lost. So that early detection would have been the key. The child has dyslexia, unable to read. When a child is unable to calculate or solve simple mathematics, it's dyscalculia.
Yeah, dyscalculia.
Yeah. So that's the problem with the child. So the child needs an intervention.
Oh, okay.
Yeah.
All right. So Kunle of High Level Makudi also wanted to know the difference between ASD and imbecile. Mr. Aboje, I'd like you to respond to that. What's the difference?
Yeah, imbecility.
Please don't use that word. We don't use that word.
Yeah, we are
that's
very,
why we want to differentiate.
We are very, very careful describing some of these because they provoke stigma.
Yeah.
They provoke stigma. Like they still fall under what we call congenital malformation.
Yeah.
Congenital in the sense that it's the individual was born like that. Do you understand? And it's basically as a result of malformation in the child's development. Something was interrupted. But in the sense of imbecility, it's beyond the nervous system. All right, it's beyond. Let's say it's beyond speech impairment. It's beyond social and emotional problems. All right, you can even see that it's broader.
Yeah.
Even the motto talking about the physical movement, that is impairment in the movement of body parts. All right, so it's broader. All right, the extent, the consequences of the malformation goes beyond. It's more severe.
Yeah.
Is a more severe, outcome of maldevelopment. While ASD, like we've been saying, presents clinically in social and emotional deficit, language impairment, and other forms of repetitive and ritualistic behavior that are absent in children that do not have ASD. So the severity of the malformation is more prominent in the former than the later. I think I would like to leave it there. Do you have anything to add?
I want to make it more clearer.
Okay.
So I want to add to what he said.
Maybe we explain
in a layman language.
That's what we love.
You understand? An autistic child, a child with ASD, looks normal.
Yes.
Physically, it's normal. The child grows well. There is no deformity, facial deformity, or any part of the body deformity. The child looks normal. It's just behaviorally that that, there's something wrong with the child.
Yeah. Okay.
Then a child, I don't want to use the word imbecile because I tend to choose my words. There's deformity in the face.
Yes.
Okay.
There's a facial deformity. Most of the times, it's Down syndrome children that they call imbeciles most times, and children with cerebral palsy that their faces are deformed and all that. Those are just the two differences. Like there's a deformity in the physique, but for an autistic child, there's no
physically an autistic child looks
there's no
normal.
Oh, okay.
Yeah,
it's all right. So thank you for that. It has cleared quite a lot of things, because if it is the sense we are talking about, then the person that said job, I think what they call job in TIV language is more of the imbecile kind of thing than the ASD situation. All right. So it's quite clear, even to men in the studio with you.
And please permit me to just Vincent Akko, he asked the same question, the difference between imbecility and ASD. And in addition, he says it's as if the prevalence of ASD is more among persons, because the first part of the question is we just cleared. Looking at the prevalence of ASD, it has nothing to do with the socioeconomic status of people or religion or race.
Exactly.
It has nothing to do. It's not connected. It's not the disease of the rich.
Yeah.
It's not the disease of the rich, not the disease of the poor. All right.
Yeah.
Any person, irrespective of socioeconomic class.
And some other persons talked about age limit. Is there an age limit? But I think you have explained that already.
Yeah. It's a disease of childhood.
It's a disease. It's easily detected at childhood.
Yeah, it should be detected at childhood, so that interventions can begin to come.
And
because
if well managed,
the individual can. Because of course, that is what we call comorbid, talking about a disease, a disorder that occurs with another disorder. All right.
Yeah.
That is ASD has comorbidity.
Yeah, exactly.
There are case of autism spectrum disorders that comes with intellectual disability. They are comorbid with intellectual disability. We have some that comes with learning disability, and we have even some that come with anxiety. All right. So talking about a child being normal, growing into a more stable adult, depends on the comorbidity. For example, the ASD that comes with intellectual disability, because when a child is diagnosed with ASD, a lot of screening is done.
Yeah.
All right. I don't know if you do that in your center. You screen, you take the child through a lot of intelligent testing and all of that. So if a child is not able to score at least 70 in a standardized intelligence test, you diagnose ASD with intellectual disability. But mostly, research has it that children that do better, adults that do better with ASD are those with what? Without intellectual disabilities. All right, they can, do well. All right, there are even those that have, a longitudinal study was done with about 11 children. Longitudinal study is the kind of study where you do over a period of time, say 20 years. Maybe children that are diagnosed, with ASD, you study them over a period of 20 to 30 years. That's a longitudinal study. And then, the person that discovered ASD, Leo Kanner, did a longitudinal study with 11 children, and 9 of them, as they were growing,
managed.
Yeah, there are even some that were died.
Okay. Right. Is it spiritual? Quickly, we are totally.
Yeah, people have different theories in explaining situations. All right, but the theory that people use in explaining their situation, especially health, is also forms a framework in their minds concerning where they find intervention. When an individual convinces his or herself that this thing is spiritual, it was caused by something spiritual. Yeah. Such a person is less likely to seek, a medical or scientific oriented intervention. Yeah. Okay. They also want to go traditional or spiritual in seeking, So all that we are trying to do, all that this program has been trying to achieve today, is to create an awareness that ASD is a disorder. Just the way we talked about addiction the last time I was here. When addiction to substance sets in, it's scientific. It can be explained. All right, is a brain disease, and then we should seek professional help in a medical setting. So the same applies to ASD. All right, we have done well in explaining the scientific background and also the scientific care. So always seek care. It's not spiritual. It's scientific. All right. It's a medical condition that should be treated medically.
We are totally out of time.
All right.
So, Ms. Grace Mecheta, go ahead and go ahead and your final words on the program.
Okay, like he said, ASD is a disorder and it can be managed. It can be managed with therapy.
Yeah.
Early intervention is key.
Very
and
key.
That's the most important thing. When you detect early, and it's always good, like when the child at that early stage, you know what a child is supposed to do at each age of the child's life. Yes. And you try as much as possible to allow the child to mingle with other children so that you can actually compare, there's something that is happening in this child that is not happening in this child. So I need to seek early help. So early intervention is key. Please, early detection is key.
Thank you very much, Grace. Okay, that was Grace Mbecheta, therapist and director, Gracious Heart Special Needs Care Home and Therapeutic Center, Makurdi. Thank you very much for your time.
Thank you, sir.
Also, Abojo Ojebe, clinical psychologist, Department of Psychiatry, Benue State University Teaching Hospital, Makurdi, and founder of Sound Life Initiative on Mental Health and Human Development. Thank you very much for your time.
You're welcome. Thank you, Mr. Fanen, for having us.
And my name is Fanen Kwan, and that will be all for today. Join us again on Friday, 9 a.m. to 11 for another interesting edition of the program. Good morning.